Great, thank you very much, and thank you everyone for joining us today. My name is Chad Lever, Director of Applied Research at Canada Health Infoway, and my colleague Jane Sparks, nurse leader from our Clinical and Change Leadership team, joins me today to present select results from the 2017 National Survey of Canadian Nurses, Use of Digital Health Technology in Practice. Before we get started, as we heard, the session is being recorded, and throughout the presentation, if you think of a question, please type it into the Q&A panel on the WebEx screen and send to all panelists. If you're attending the session in a group setting, write your question down and share it with the person hosting the WebEx, who will type and submit your question via the QA function. As we reach the Q&A part of the session, we will direct questions to either Jane or myself and repeat questions for everyone to hear. The 2017 Nurses Survey was a collaboration between the Canadian Nurses Association and the Canadian Nursing Informatics Association and Canada Health Infoway. The survey sought to understand the current use of electronic record clinical information systems by nurses in Canada across clinical practice settings. The study compares progress to the first National Survey of Nurses conducted in 2014 and explored attitudes and perceptions related to access, implementation, and the impact of use of digital health technologies on nursing practice. For this study, we define electronic record clinical information systems as an electronic patient information or record-keeping system enabled with a broad set of clinical and communication functionalities, inclusive of hospital and/or clinical information systems, electronic medical record systems, and provincial, territorial, or regional electronic health record systems, or EHRs. EHRs comprise a longitudinal record of patient information and are primarily comprised of laboratory results, drug or medication information, diagnostic imaging, and may also include patient assessment forms, referrals, and consultation reports. Today's presentation will provide an overview of the current adoption and use of electronic clinical information systems among Canadian nurses, providing direct care to patients across select practice settings. We will highlight nurses' perspectives on the adequacy of electronic systems for nursing practice, confidence in using systems, as well as perspectives on engagement in the design and use of systems, implementation, training, and ongoing learning and development to advance use, and we will also share key resources and how you can access the 2014 and 2017 survey datasets for further analysis and inquiry. So, about the survey. Our collaborative working group developed the 2017 questionnaire, and we kept some core tracking metrics from 2014, but also added a number of new areas of inquiry. A multi-method sampling and recruitment methodology was used, and we invite you to access the full report for a complete overview of the study methodology. The online survey was available to complete between January and March 2017 in both English and French, and was hosted by Environics, who also completed the top-line analysis and final report. To support access to the survey by nurses in Canada without access to email or online promotions, an advertisement was printed in the January 2017 issue of Canadian Nurse with the French and English study website addresses. Over 20,000 nurses subscribe or receive the national magazine. Nurses completing the survey were also eligible for an incentive draw managed by Environics. In total, 2,058 nurses completed the 2017 survey. The sample is nationally representative of registered nurses in Canada by age, gender, and province, and weighted accordingly to CNIA 2015 national data in all analyses. The weighted demographics for the study sample are shown here. The majority of respondents report clinical care as their primary nursing practice domain, with nurses from all other domains also represented. The majority are registered nurses in full-time practice, and 36% report they have been in practice for over 25 years, with early and mid-career nurses also represented. The community size, The community size of respondents' main work setting ranged from small towns to large metropolitan areas. A total of 1,342, or 67% of nurses responding to the survey, currently provide direct care to patients. The majority of today's presentation will focus on this sample segment. Among nurses providing direct patient care, 29% report community-based care as their main practice setting, and 55% reporting their main practice setting is hospital-based care. Nurses practicing in other settings like the Canadian military, government, or private industry also completed the survey but will not be concluded in the analyses presented today. So, patient record-keeping systems in use by nurses providing direct patient care. Overall, nurses in Canada providing direct patient care continue to report that the main patient record-keeping system they use in their practice is a combination of paper and electronic systems. No significant change from 2014. Shown here are the current patient record-keeping systems nurses in community and hospital-based care settings are using. 78% of nurses in primary care are using electronic instead of paper systems, which is aligned to recent primary care physician-reported EMR use in Canada. Hospital settings and departments are indeed electronically enabled, as you can see. However, the majority of nurses practicing in these settings manage a combination of paper and electronic systems to support patient care, as illustrated in the green segments of the graph. Among nurses using electronic records, entry of clinical documentation is a relatively new practice overall, with 41% of respondents using this functionality for the past 2 years or less. Maturity of nurses' use of electronic systems to view or retrieve patient information is more mature, with 72% of Canadian nurses using electronic systems to view or retrieve patient information for at least 3 years or more. Looking at the overall sample in this slide, that's the 2,000 respondents, the majority of Canadian nurses report they are using admin data captured from electronic systems in their role, whether they are nurses providing direct patient care, nurses in a supervisory role, or nurses that do both. For the most part, nurses use data from electronic systems to support practice, and as expected, nurses in supervisory roles are significantly more likely to use clinical or admin data from electronic sources than nurses providing direct patient care. The survey asked nurses providing direct patient care and using electronic records about the impact of using these systems on the quality of patient care they provide and practice productivity. Shown here, the impact of electronic record use on the quality of patient care has increased from 2014. 56% of nurses providing direct care to patients and using electronic record-keeping systems say that the quality of care they provide is much better or better since implementation. Fewer in 2017 report that there has been no change. Additional analysis we undertook showed that nurses who exclusively use electronic record-keeping systems are more likely to report improved quality of patient care than nurses using a combination of electronic and paper systems. We also found that nurses who are new to the use of electronic systems, so have been using less than a year, are less likely to think that the quality of patient care has gotten better or much better compared to nurses who have been using electronic systems for more than 2 years. By setting, results suggest that nurses in community-based care have a more positive view on the impact of their use of electronic systems on quality of care compared to nurses in hospital-based care settings, with the exception of nurses practicing in outpatient ambulatory care and the emergency department. This slide shows the overall finding again, with the number of different functionalities on the left-hand side that nurses report using in 2017. Results here illustrate that nurses are more likely to report a positive impact of electronic record use on quality of care that they provide, the more electronic functionalities they use to support patient care. In terms of the impact of electronic record use on practice productivity, more nurses in 2017 report that electronic records have greatly increased or increased practice productivity compared to 2014. As with quality, results suggest that nurses in community-based care have a slightly more positive view on the impact of electronic record use on practice productivity compared to nurses in hospital-based care, with the exception again of nurses practicing in outpatient ambulatory care and emergency care. This slide shows the overall productivity finding again, with a number of different functionalities on the left side that nurses report using in 2017, similar to the impact on quality of care we noted earlier. Nurses are also more likely to report the report electronic records improve practice productivity, the more electronic functionalities they use to support patient care. We also looked at specific functionalities nurses use in patient care. With regard to specific functionalities nurses report using in 2017, 76% report using secure electronic communication with other providers to support patient care. Nurses' use of electronic clinical documentation, medication lists, ordering or order entry of labs has also increased from 2014. In 2017, 42% of nurses providing direct patient care report they access and use provincial or territorial electronic health record information systems. Among those with EHR access, 36% require only one login or have single sign-on. The majority, 57%, require multiple logins to access the EHR. EHR access is reported by nurses across all practice settings as shown in this slide, but there is variation in access within settings. Well over 60% of nurses in public health, outpatient ambulatory care, and primary care settings report having EHR access. Only 30 to 40% of nurses practicing in other community or hospital-based care settings report access to the EHR. We further explored the complexity of nurses providing direct patient care and their use of single versus multiple patient information systems to support both clinical documentation and access to patient information in a typical patient clinical encounter. Shown here, 42% of Canadian nurses report using one electronic system to document patient information, and 26% report using one electronic system to access patient information. Whether to document or access patient information, the majority of nurses in Canada report they use multiple electronic systems, or an electronic system as well as paper, or two electronic systems as well as paper to document and or access patient information in their support of a patient encounter. So in 2017, 56% of Canadian nurses use multiple systems to document, and 72% use multiple systems to access patient information to support a single patient encounter. Among nurses using multiple electronic systems to support a patient encounter, 76% report that they require multiple logins. Only about a fifth, 22% of nurses report having a single sign-on, but 4 in 10 say they typically need 3 or more logins to support a patient encounter. So, in summary, since 2014, we found that nurses are still working in a largely hybrid environment in terms of patient record-keeping systems across a number of care settings as shown in our care setting slides. While primary care family medicine offices are quite advanced in use of a single electronic record, the complexity of multiple systems persists across settings. Access to the EHR across all care settings is present with notable advances in community and outpatient care, as well as nurses' use of admin data in their role are both very promising findings. And the increase in nurses' perception of electronic use on quality of care and practice productivity is also promising, in particular the finding that using more functions advances more value for nurses. With that, I will turn it over to my colleague Jane.
Thank you, Chad. Now let's take a look at the nurses' perspectives on the adequacy of systems, confidence in use, engagement, implementation, training, and ongoing learning and development. With regards to adequacy of electronic clinical information systems for their role, the majority of nurses surveyed, 53%, reported that the systems that they are using are adequate for their role. This is an increase from 2014. In fact, the results show that nurses practicing in care settings that exclusively use electronic records to enter or retrieve patient clinical information are more likely to say that their systems are adequate for their role, in comparison to nurses who use a combination of electronic and paper systems to enter or retrieve patient clinical information. As might be expected, nurses who are satisfied with their system and see an improvement in patient care are more likely to believe that the systems in place are adequate for their role. Moreover, those who feel that the patient care they provide as a result of electronic systems has improved are also more likely to say their current systems are adequate for their role. So let's drill down deeper to see how this looks within the care settings. As you can see from the slide, 80% of nurses working in primary care, family practice, medical offices responded that the systems that they are using are adequate for their role. whereas those nurses working in community clinics, nursing homes, and home care settings indicated this is the case for 35%, 38%, and 34% respectively. The percentage increases for nurses working in public health and the hospital sector, including community hospitals, academic health science centers, and non-academic health science centers. Within the hospital setting, medical, surgical, and critical care units, 56% of nurse respondents believe that the systems that they are using are adequate for their role. With regards to nurses' confidence in using electronic tools, there is a reported increase in confidence since 2014. In 2017, 91% of respondents report feeling very confident or confident in using electronic tools in their practice. In fact, the more functionalities used reflected in a reported increase in confidence. We explored confidence by a number of factors. Nurses in community care setting are more likely to be confident in using electronic tools than those working in hospitals. Nurses who are using electronic records exclusively to enter, receive, and retrieve patient clinical notes are more likely to say they are confident using electronic tools in comparison to nurses using a combination of electronic and paper. Nurses with more than 1 year of experience using electronic systems to both view and enter clinical notes are more likely to say that they are very confident using electronic tools as compared to those who have been using electronic systems for less than 1 year. Lastly, nurses who are highly satisfied with their systems and with the quality of training and access to ongoing learning are more likely to say that they are very confident in their current use of systems in their main care settings. Now let's have a look at what the respondents indicated when asked about their level of consultation in the decision-making process regarding the introduction of electronic records into their main practice setting. The results are unchanged from 2014. What we do see here is that nurses in administration and supervisory roles are significantly more engaged than nurses practicing in other capacities. Nurses who feel their current systems are adequate for their role are more likely to say they were consulted a great deal or quite a lot than those who do not feel that their systems are adequate for their role. Those nurses who are more satisfied with their systems are more apt to say they were consulted at least quite a lot than those who are dissatisfied. Lastly, just 3% of nurses who say no consultation was undertaken feel that their peers were adequately consulted about the decision to introduce electronic systems into the practice setting. So what we're seeing here is that consultation is critical to nurses' perceived adequacy and satisfaction with the systems that they use. Now let's have a look at engagement. Nurses were asked, how much have you been able to have input on the use of electronic records or clinical information systems and tools in your main care setting? Nurses who feel their current systems are adequate for their role are more likely to say they have had a great deal or quite a lot of input on the use of electronic systems than those who do not feel their systems are adequate for their role. 9% of nurses who say they were not able to provide input at all say they feel their peers are able to provide input on the use of electronic systems. So what we are seeing here is that ongoing engagement of nurses on the use of clinical information systems in their care setting is critical to the perceived adequacy of the system for their practice. Nurses providing direct care to patients and who are using electronic record keeping were asked about their level of satisfaction with the formal training received to use electronic clinical information systems. In 2017, 60% were highly satisfied or moderately satisfied with the quality of the formal training they received. However, this slide shows that only 40% of nurses are satisfied with ongoing learning. We also found that nurses who are highly satisfied with their systems are also more likely to be satisfied with the level of ongoing learning available. Now let's have a look at both the benefits and barriers. Nurses providing direct care to patients and in using electronic record keeping, N equals 1,031, were asked. Thinking about your practice in your main care setting, rate the impact of your use of electronic records or clinical information systems and the quality of nursing care you provide during a face-to-face encounter. I won't read through all of these next few slides as they are quite detailed. I will pause here for a moment for you to review. As Chad mentioned, the data is available free of charge at the University of Victoria Dataverse for those who are interested in doing their own analysis. Additionally, a version of these slides are currently available on the Infoway website. So this next slide is a continuation of the previous. Additionally, nurses reported that they are primarily using the systems on stationary devices desktops, and laptops. Access to mobile devices is currently very limited. Although almost half of nurses surveyed reported that use of mobile devices is essential to their practice. I will pause for a moment and speak to the top 4 reported benefits on the next slide. Here are the top 4 benefits of electronic records and clinical information systems reported by the respondents. The following percentages are a combination of somewhat and to a great extent responses. 60% of respondents report that improved communication among teams and among clinical providers within their practice has been the leading impact. 53% say that the use of electronic records has improved communication to support patient care transitions. 45% report that the use of electronic records has led to evidence-informed practice. Now I will highlight some of the barriers reported by the nurses and compare the results to what we found in 2014. All areas that were measured show some improvement, although modest in some cases, with the exception of does not align with clinical workflow, which has actually increased slightly, and unreliable network connection remains the same at 22%, which is notable. Almost half of the respondents report functioning in a hybrid environment of both paper and electronic as a barrier to realizing full value from the electronic systems that they use. Multiple logins at 36% is also notable. Close to 1/3 of nurses reported a lack of available equipment as a factor. On this next slide, we are also seeing modest improvement where compared to available 2014 survey results. I will pause here for a moment before I move on. At the bottom of the slide, you will see that very few nurses feel that too many clinical decision support alerts are a barrier to fully realizing the benefits of electronic systems. During the survey, we took the opportunity to ask all of the respondents about their level of familiarity with the following: Nursing Informatics Entry to Practice Competencies for Registered Nurses, Canadian Health Outcomes for Better Information and Care, CHOBIC, International Classification for Nursing Practice, ICMP, Infoway National Change Management Framework, CAUSIN Faculty Teaching Toolkit, CNIA, Consumer Health Solutions, Logical Observation Identifier Names and Code, LOINC Nursing Physiological Assessment Panel. As you can see here, with the exception of Nursing Informatics Entry to Practice Competencies for Registered Nurses, reported levels of familiarity are very low. Reported use is extremely low. The Nursing Informatics Entry to Practice Competencies for Registered Nurses had the highest level of familiarity at 35%, and LOINC Nursing Physiological Assessment Panel at the lowest at only 6%. Of note, CHOBIC, NOMED-CT, ICMP, and LOINC Nursing Physiological Assessment Panel are all included in the new CNIA position statement on nursing informatics posted on their website. Use of standardized clinical terminologies that are the most capable of representing nursing documentation in electronic health records and standardized assessment methodologies support safe, quality patient care across the continuum. So here are only a few of a number of key takeaways from the survey results. A majority of nurses continue to be using a combination of paper and electronic systems in their main practice setting. Less than 1 in 4 are using paper-based systems. This mix of paper and electronic use continues to be the most significant barrier identified by nurses and may be having an impact on overall satisfaction with their systems, a sense of adequacy of their system, and their level of confidence when using them. Nurses who are using solely electronic systems are much more positive about their impact on productivity, improved quality of patient care, and confidence in their skills. This suggests that once the full transition has been made to electronic systems, the true benefit can be realized. Moreover, the results show that a learning curve continues with nurses who are new to using electronic systems. The findings from the survey indicate that this group of new users, less than 1 year, have yet to see the benefits to productivity and positive impacts on patient care. While they recognize some positive impacts of these systems, it appears that they are continuing to be in a learner phase and have yet to master the system. And now, I would like to invite questions. Please type in your question using the chat box feature in the Q&A panel on the lower right-hand side of your screen. While we are waiting for questions to come in, I have listed a number of valuable resources that may be of interest to today's webinar audience. These links will also be sent out when the recorded webinar becomes available. As mentioned in the survey, Infoway's National Change Management Framework, which is designed to support change management leaders and practitioners, frontline clinicians, managers, and senior leaders who are implementing solutions into their organizations. Infoway's Benefit Evaluation Toolkit, which is designed to help organizations to implement, adopt, and promote digital health solutions. Infoway and the Registered Nurses Association of Ontario, RNAO, partnered to create this new best practice guideline, Adopting eHealth Solutions Implementation Strategies. This guideline contains strategies to ensure effective implementation of eHealth technologies. The Paper to Electronic MedRec Implementation Toolkit, second edition, released April 2017. The toolkit highlights emerging evidence for electronic medication reconciliation implementation and provides resources to support those implementing eMedRec. The Pan-Canadian Nursing EHR Business and Functional Elements Supporting Clinical Practice Reference Document, which was created to support the inclusion of nursing data in the EHR. Created a number of years ago by leading nursing informatics experts, the content remains relevant today. And lastly, the Canada Nursing Informatics Entry to Practice Competencies for Registered Nurses. Please feel free to submit any questions after the presentation to the Clinical and Change Leadership email at clinicalandchange@infoway.ca. Next slide. I would also like to take this opportunity to invite you all to join the new Clinical Engagement Network on Infoway's InfoCentral Collaborative Platform and our very active medication management community, which has over 250 members from across the country. To date, InfoCentral has over 20,000 members who are interested in connecting, joining the conversation, and staying up to date on the many aspects of digital health. And now back to you, Chad.
Great. Thank you very much, Jane. And thanks for those who have been submitting some questions through the Q&A function. I have a few to start with. The first one is, we noticed that there are no respondents from Nunavut or Nunavut territory. Why might that be? We undertook a multi-method recruitment process, as I mentioned before, and all provincial nursing associations were contacted through the CNA and various networks through the CNIA to extend the invitation to participate. And we also worked with Infoway networks as well and communicated the invitation that way, as well as with other nursing publication distributions that occur all across the country. So I can't say for sure if nurses in Nunavut did not receive an invitation. I think we did our best to extend that across national networks as much as possible. But it's certainly something that we can look to improve the next time that we do the survey to get more represented nurses from northern and remote communities, and we can tell a better story there among that practicing segment of nurses. The next time we plan to do the survey is in 2020, so we have some time to improve our approach to recruitment and sampling for the national survey and capture nurses from all areas of the country. Another question I have that's come in is for Jane. Jane, the question is, did you track satisfaction with quality of formal training to compare to 2014?
No, this is a new question that was added in 2017, and the survey was very comprehensive. We could only share with you today a small segment of the key findings, but that was indeed a new question, so we don't have that at this point.
Okay, thank you. The next question I have is, when was the survey distributed? I'm from PEI. Health PEI did not recall being invited to participate. It was distributed through January and March. I believe that the CNA contacted all provincial associations, and the invitation to participate would have come out through direct email or through nursing newsletters, again, through January to March of 2017. A third question I have is, where might Infoway's investments be reflected in these study results? I think you have to dive rather into the data to really answer that question, but I think from the results we presented today, they can be seen quite clearly in the illustration of nurses' use of electronic records in community-based care at 78%, as well as in the advancement of use of electronic records in outpatient care. Infoway has had a number of investments in ambulatory outpatient care, and we saw that metric there in a number of the setting slides be quite advanced. Okay. Next question is multiple logins. Are you seeing the, let me just scroll here. Was the use of multiple logins to do with the lack of integrated systems? Again, I think a by-setting analysis will be really important to do with the data on this front. I suspect that having to do multiple logins may have something to do with lack of integrated systems, but one must first understand those systems and settings that one is looking at in order to determine if there is a lack of integration there, because there is a number of settings at the moment where the systems are integrated or are integrating. Hi, this next question is for Jane. Jane, what findings surprised you the most from the survey?
That's a great question. I think what I would like to look at that made me think was that a number of our respondents had been practicing for a longer period of time, and what we're seeing is that use of systems over time improves in the nurses' perception of quality and productivity. I would like to go back to the data and see if there's any correlation there, because I think that would be interesting. But I was happy to see that the login numbers were improving and the integration of the systems, as Chad mentioned, but I can't say that I was too surprised to see that the numbers were as high as they were.
Great. Thank you, Jane. Another question I have is, are there going to be initiatives as a result of these surveys? For example, will there be training lessons for nursing students regarding use of electronic patient record so they can be more familiar once they start practice? What I can say, there is an initiative underway with CASN, the Canadian Association of Nursing Schools, to develop content and lead that with their schools. So there is with 94 schools across Canada. So there is actually initiatives underway to build up that content and bring it forward to nurses coming into practice. Another question I have is, were there any issues identified regarding difficulty finding information within the electronic health record? That actually is a very good question, and I think what we'll do is take that away as a potential new question to add in the 2020 survey. We didn't ask discrete questions about the process of looking for information in the survey or the time implications for that, or the complexity or the accuracy of that. So a question like that I think I'd like to take away and use as a good input to our development of the 2020 survey. So thanks for that. Another question is there evidence on how often education refreshers would be required? I don't think there's evidence from the survey on that. Jane, would you have a response to that?
No, I don't think we got that from the survey, but certainly it's food for thought as to what would be best practices, but ongoing learning is key, is what we saw.
One of the final questions I have come in is, are you evaluating the potential for fragmentation of information in an electronic health record structure and the associated risks? Again, I think that's a very, very good question about the content of health information in an electronic record and what that means for practice and outcomes of care. Good question for us to take back to the 2020 survey development process. So thank you for that. Okay. So just in closing then, and thank you everyone for your time this afternoon, I want to highlight once again that the survey databases for both 2014 and 2017 in SPS format are available at the University of Victoria Dataverse site. Here is the link. You will receive this also in a follow-up email with the webinar recording and links to the resources that Jane outlined. There is a direct link there to the 2017 database as well. Canada Health Infoway has a few databases on the Dataverse, including the 2014 2014 and 2016 survey of Canadian community pharmacists. Other databases will soon be coming available over this year and next. And thank you again for your questions. If you have specific questions for Jane or myself, please feel free to reach out.
Thank you again for joining us today. This concludes today's web conference, and you may now disconnect. Have a good day.